Incubators are usually university affiliated and or economic development driven, whereas accelerators are usually for profit.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com. Today, our focus on the Business of Healthcare podcast is on innovation, entrepreneurship, and startup activity in the healthcare area. And nobody better to talk about this than one of our local leaders, and that's Dr. Hubert Zajicek, CEO, co-founder, and partner of Health Wildcatters. Welcome to the podcast, Hubert.
Thank you, Bob, and great to be here.
Well, you know, the name Wildcatters, being in Texas, you have to understand what that actually came from. And I want to kind of get your vision on how you came up with that name. But a wildcatter is one who drills wells in the hope of finding oil in a territory not known to be an oil field. How does that apply to your organization?
Well, we're definitely looking for oil in the area of healthcare innovations. So we're looking for diamonds in the rough. We're looking for the new and innovative stuff that's not yet out there. And so our investors take a lot of risk as well, as do we, on the startups we take in every year. And so the analogy stands about there. This is as close as I can get.
Very good. Well, I know, Hubert, you've been at this for quite a while, since 2013, and your journey starts early. You're a medical doctor, of course, and you've been involved with a lot of research in the past as well. Tell us your story. What caused you to take a fond interest in entrepreneurial activity, especially in the healthcare space?
Yeah, thank you. Yes, you're correct. I born, raised, and educated in Vienna, Austria, where I went to med school, graduated in 96, moved over here to the United States to be a postdoc, and became an NIH fellow at UT Southwestern. Got some more grants, joined the faculty in nephrology and cell biology, and then got an MBA. And that's really where the interest in entrepreneurship for me bubbled up. Participated in the business plan competitions and liked it so much that I decided to switch out of academia and join a medical device incubator in Frisco, Texas, north of Dallas, that I helped build and co-lead for several years. And then in 2013, started Health Wildcatters.
So you say the word incubator, and I hear the word accelerator. Help our audience understand the meaningful difference between those two.
Yeah, I was asked that many times myself, and actually came up with my own differentiator and explanation for what's going on, what's the difference. And that is that generally in my mind, incubators are usually university affiliated and or economic development driven, whereas accelerators are usually for profit, which is the case for us as well. Number two, incubators usually run open-ended programs. So 1 year, 2 years, you can join on a rolling basis for local entrepreneurs who need the help. Accelerators run in usually 3 to 4 month batches. So it's a cohort-driven, class-driven type of structure, and it runs competitively, which means you get startups from all over the world, which is certainly the case for us. And thirdly, generally, incubators do not invest. Obviously, none of these stands on absolute terms. There are exceptions, but generally don't invest. Whereas accelerators, that is an integral part of an accelerator, is to have investors and investment.
So early on, you got the bug, so to speak, in a competition, a business plan competition. And you can relate to the challenges that are associated with that. And then when you look out into the industry, what are the types of things that the entrepreneurs are being faced with today? I don't think of healthcare as a place where a lot of innovation takes place. You know, it's kind of keep the status quo, don't change this out, don't mess with that. How do you deal with change in a environment of startups?
Yeah, I mean, we all, as physicians, were an oath to first do no harm. While the actual oath is quite a bit longer, that is a very, very important piece of medicine. We are, I think, as a group, generally extremely careful and hesitant to adopt new technology. And as such, I think if you look at the iPhone, healthcare is probably the last piece joining the mobile phone revolution, if you want to call it that. I used to point out financial services in healthcare, and the bus has left of financial services. We're all banking on our phones now. So a few years ago, that wasn't the case. So healthcare is really the one where it's still kind of coming together. Most institutions have an app or something, but it's not quite gelling yet for us. So that's just one example of healthcare being behind. At the same time, things take much longer because, again, following the mantra of not desiring to do any harm, you got to take extra steps. And of course, there's also a lot of laws that are out there to protect patients. So innovation just cannot happen at the same pace for the good of the patient. And that's kind of built into the system.
You know, we look at the coast, we look at the West Coast, we look at the East Coast, we look at a lot of places where there's venture capital and, you know, high risk money that flows. And here we are in the middle of the United States almost, and we do not have anything attractive like mountains and beaches. But I heard an interesting statistic that Airbnb here in this area is big simply because of healthcare. There's so much healthcare going on in the Dallas-Fort Worth and this general area that, you know, people come here for that, and therefore they need a place to stay instead of a hotel. So what's your perspective on how ripe of an environment this is here? Is this a healthy place for innovation? It's not the Boston 128 corridor, it's not Silicon Valley, but you have seen a lot happen in the last 9 years. What's your perception of why this works so well here?
Well, I mean, let's be clear. We don't have the major venture capital the coasts have, and we're not super close yet. And I would say that our region has enormous strengths that are being undervalued on an ongoing basis. And what's happened over the last 10 years or so, things have started to come together. So you start having the overall demographics of, you know, a 747 landing full and leaving empty on a daily basis. You've got tremendous population growth in Dallas, and you have hospital systems that I always thought are interesting because there are several systems that are sizable that are competing with each other. And in Dallas, or when I say Dallas, I usually mean the region, they are overlapping each other, meaning that they're competing with each other, creating a need, number one, to be better and more innovative, but also an ability for physicians, providers, anyone that's in the system to switch and go with where they believe they can serve their patients better. So I think there are many aspects to the region being very robust. I also think we have had a couple of starts in the region with a lot of hype built around a single success story in the last 30, 40 years. And that's, I think, been a cautionary tale to say, okay, well, if we're building this the next time, it's got to be solid. And I think this is what you're seeing. You're seeing a convergence of many factors in our region, also paired with strong economic tailwinds in a state that is still probably the least, one of the least taxed and sizable in the country. And so a lot of things converging, and I think based on that and the core strength in tech, which several other comparable sized cities don't have, that you can start seeing tech becoming more and more. And when I mean tech, I mean computers becoming more important in healthcare. And so I think there's a lot to be said about the inherent strength of our region, especially forward going.
You have found success in certain disciplines, digital health, mobile health, medical devices. Is that unique to our area? Do we have strength that supports that, or is that just a preference that you've seen opportunity?
Well, as an accelerator, we've always had a worldwide call for the best and the brightest. Needless to say, as any entrepreneur, when you do that the first time, you don't have the reputation to back that up. While we had undoubtedly wonderful people backing us, we just weren't known as a brand. That has changed quite significantly for us. It's built on a year in, year out, delivering the best startups that found us and helping them gain traction to further their particular devices or technologies. And I think that's important to remember when you are building something. You got to take your time. You got to do it right. You got to build a reputation. And then things, can appear to get easier. I will just say they never get easy because other things start becoming interesting. But overall, you start seeing that you can tell a compelling story of why a startup should move to our region or associate themselves with us, because they tell the story themselves through others that are out there.
So why don't you take a few minutes here, Hubert, and familiarize us with the process that someone would go through if they wanted to be part of what you're doing at Health Wildcatters. What would be the starting point? For example, if I have a new idea, a new technology, and I think it's going to be considered deep technology, and it could make a big difference in the big picture, would I be a candidate to be part of your program? And if so, how would you go about getting involved? Kind of take us through that process, if you would.
Absolutely. Well, first of all, we're very open towards any kind of innovation. A lot of accelerators, and really the territory where they were born was in tech, and tech, period, not health tech. And so most accelerators are going to be basically digital health accelerators. So there are some that do medical devices and digital health. We've always, there's 2 of us who are physicians, 4 of us that are deep in healthcare, backed by hundreds of mentors and investors. We've always thought, okay, for us, you just need to show us something that we believe can move the dial. Both it's backable in the sense that it's something that can find traction with funding, can make a difference, and then see on the patient side, see an impact that they can create with this type of technology. The advantage we have in healthcare, of course, as you know, is that we don't just get to benefit from the actual cash bottom line, but rather we get to also see startups truly having an impact on patients. And that's really where I come from. So as far as the process goes, startups apply to us, and you should expect several hundred to apply to us every year. We have a batch process that goes for several months. During that time period, we have information sessions and get-togethers and all sorts of opportunities to get to know us a little bit better and our ecosystem. And then out of those hundreds of applications, about 50 will make it into the first round. That means we will book an interview with them, these days mostly on Zoom, but also in person, for my partners and me and a few others that are deeply involved in this process. And out of that preliminary round, you get into the finals, which is an in-person generally, but we have allowed also a Zoom participation event where we invite our investors and mentors to participate as well. They vote on those 25. And out of those arise 10 that are our top 10, and those will be invited to our program. And so that's the technical side of the process that happens in the July time period, last piece. The rest of July and beginning of in August, we use to onboard the teams to take care of all the logistical pieces of moving here, which this year involved teams from Austria, France, Israel, and India, and all over the country. I mean, frankly, yes, there's an extra burden moving in from another country, but once you're not within driving distance of a commute, you're moving here for the duration of the program. We're fairly flexible on that process, meaning that we have dual participation via Zoom as well, but the maximum advantages get derived from face-to-face in-person interaction. So we encourage strongly the in-person participation.
So when a candidate gets approved and accepted as a cohort member, how much time do they have in the acceleration process? I guess you have to fasten your seatbelt because you're going to take off pretty quick. How long do you get to participate, and what do you do once you graduate, so to speak?
Our startups are actual startups, meaning that they know what they want to do. They have impressed several rounds of people with what they're doing and their backgrounds and the problem they're tackling. They can be quite advanced in certain respects, but each of the startups has a different reason why they're participating in the accelerator. They're not all biomedical engineering grads from this May that want to apply this fall. So it's all over the place. It's all over the map as far as ages go too. We have 20 somethings and we have 60 somethings in our program, and we love that. I can't even begin to tell you the diversity across countries, ethnicity, gender. It's been quite amazing. So when you put the call out there for the best and the brightest, I can promise you there is a very diverse group that is attracted to that. And we've been blessed with seeing that reflected in our startups every single year.
Do most of them have a minimal viable product to start with, or maybe not?
Yeah, so it differs from startup to startup. So in the digital health space, you would expect a functioning prototype, maybe even already something that's being tested. If it needs FDA, then it's probably pre-FDA, but it's ready to go. So the digital product is usually done, not always, but usually. Medical devices, functioning prototype, pathway to FDA figured out or in broad strokes, and some feasibility studies probably done as well, probably in animals, something early. If it's pharma, all bets are off. We have taken a few pharma companies. They're very early, usually some initial screens that were positive and some early studies. Patents are usually either applied for and pending or issued, but there's usually IP has been filed. And then it gets quite diverse what they bring to the table, how far along they are.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So when you graduate the program, what are the expectations?
So not all startups are raising funds coming out of the accelerator or desiring to raise funds, but it is one of the top, if not the top, motivation. Generally, a startup will gain traction on the fundraising side through friends, family. Sometimes we say friends, families, and fools. And it's people that know you, and it's people that will invest in you because they know you. And needless to say, a venture capitalist or an angel investor who does not know you, that's external money. This is somebody who's giving you their hard-earned money. And the conversation is a lot different than with your grandpa. Grandpa will give you the money and love you, but if you know knows anything about what you're doing, then it's probably going to likely be very little. Whereas when you're now asking strangers, as I always say, strangers for money, well, you got to have your story together. And so during the program, we help them tell the story. I mean, that's the shortest way to explain it. Obviously, there's a lot more going on. We're looking at everything that they might be missing. And those are blind spots that they may or may not have identified themselves. Through the exposure to dozens and dozens of mentors and hundreds of people, they themselves start getting much, much better at telling the story.
Yeah.
To see what resonates. They get to try that out. They get feedback. I could go deeper into what the program does. But to answer your question on what happens afterwards, well, they stay part of our cohort out of alumni network. Some have gone on to sell their companies and come back as mentors. Some have come back as mentors before they're exiting, and some have come back as mentors and investors in younger funds thereafter. We have 99 startups to date and are working on, I guess, 100.
Wow. So when we stop and look at the success factors of Health Wildcatters, quite a reputation. Obviously, you've been at it for almost a decade now, and the people that have successfully come through your program. Let's talk a little bit about your ecosystem, the sponsors, the mentors, the investors. How do you go about arranging all of that? That seems like a huge undertaking in its own way, not even looking at the entrepreneurs, but just that other group, the sponsors, mentors, and investors.
Absolutely. It's, we are here, and it takes one conversation at a time. One of the most important things I tell my startup entrepreneurs is that there are no shortcuts. Meaning, when you represent something, you have to be able to back that up with data and truth. That doesn't mean that entrepreneurs aren't going to go to the edge of what they can support. And I am not going to judge them on that. That's what I call chutzpah, and you gotta be able to go for it. But at the same time, when you make certain statements, and this is a great example of something that they couldn't possibly know, you make certain statements in financial conversations. They may or may not know the meaning of those statements. When I say committed capital or I have X amount in the bank, those things have meaning. And so we're here to help them do it the right way, build trust with their future support network. And we haven't done it any other way. So each of our backers, whether it's a sponsor, a mentor, investor, that is helping us, is someone we've gotten to know over many years, somebody who maybe was referred to us by someone that knows about us, someone who wants to have an impact in health innovation. And we're talking about sponsors, for instance, firms that want to play a role in that want to be seen as supporting that, and they do that with their sponsorships. And on the mentor and investor side, it's a similar thing. That mentors are all accredited. The investors are all accredited investors. So we're like an angel group, basically, that they can invest in a single fund and be done with it if they want to just do one. And at least with one check, they're invested in a bunch of different startups, right? So this is kind of the advantage they get out of it. But ultimately, it comes back to building it slow and solid, and having a lot of great people give us their support. On the sponsor side, I want to add too, a lot of people in our region, specifically in Dallas and Texas, know us for the things we're doing on the, what I call the nonprofit side. So we are a for-profit entity, but the sponsors are basically the ones that allow us to do the things in the community that we otherwise couldn't justify. I cannot go to my investors and say, hey, don't you love doing hackathons? We're going to spend X amount of dollars on the hackathon. Isn't that great? Well, they love that, and probably they would say yes to a certain amount. But ultimately, it's wonderful to have the backing from sponsors so that we can tell them this is supported by sponsorships. So we do hackathons, investment conferences, competitions, educational series, open office hours. Everything we do in the community is basically backed by our sponsors. The investors create the engine that allows us to do all this. So it's the most clear-cut form of conscious capitalism that I can come up with, without having to come up with any excuses for it.
Well, you said the word hackathon, and you started up a health hacking crisis network. Share with us the idea behind that and who was involved and why it happened.
Well, the why it's a COVID story. So I was sitting at a beach in Florida and everything was being shut down hard in March. It was spring break for my kids. And I simply couldn't escape the fact that I knew a lot of people and I felt an urgency to help. So what I did was to create a Facebook group that ultimately ran on several networks of just people who were, number one, willing to help, and number two, in some way, form, or fashion able to help, meaning some sort of a background that they had that enabled them to help. And what I mean by that was, at first, it was the immediate problems, things that we all faced with personal protective gear and fabricating it. And this group, which grew to over 500 very quickly, and we really put the brakes on it because we wanted people in there that didn't just love it, but actually were able to contribute through their engineering skills or their medical knowledge or their, you name it, technical knowledge, marketing, whatever. So professionals are willing to help, no strings attached. And this was just a movement, really. So we ended up spinning off various interest groups, working on different projects. There was no intent to own these projects, just to help the respective groups fulfill their mission, get them what they need. We participated heavily in masks and producing those. It was really the cutting edge because we didn't know which ones worked right and which ones were worth wearing and all those things. So this was the initial genesis. This group was done chartered as a 501c3 nonprofit and has since done projects supporting hackathons and various other initiatives that allow us to continue to do things in the community with people who are maybe not necessarily starting their own thing. Basically, they may not be entrepreneurs, but they still want to play a role in health innovation. So the Women in Science and Health Network is another initiative born out of all that, which is basically a mentoring group for women that desire to be entrepreneurs, but maybe aren't yet. And so that's become hackathons, and then from hackathons into a network that meets monthly and mentors entrepreneurial women in healthcare that want to start something.
At the Naveen Jindal School of Management here, our executive education group, we have a couple different programs. One's the Alliance for Physician Leadership, and we have a scalability problem. We have a waiting list, almost 2 years to get into the program because we only have space enough for 50. So today in our classroom, it's pretty full. What's your perception on access versus space? Do you have to scale space and get more space for your cohort teams, or are you doing more virtual activity nowadays, or a combination thereof?
We've stuck to the formula. We've played around with it over the years a little bit. Could we take 20? Should we take 5? Should we split it up into 2 cohorts? What is sustainable? And we ultimately, for all practical purposes, stuck to the 8 to 12 startups every year. It's a number that our mentor network can support. It's a number that allows enough attention to detail to make them successful. And, without, talking about other people's business models, sometimes these type of enterprises can get to be more like factories, and the personal relationships aren't able to be furthered the same way. And it's the same with your class size, right? So there are limits and reasons why you keep that at a certain size. You want to be able to get to know these people and have a meaningful conversation, not have them feel like they're just a number. So it's the same for us, but I think it's an important thing to keep in mind, just like for you. How can you multiply the success? How can you have a great impact? How can you have more people benefiting from something that you believe is obviously in strong demand, which you have the evidence for?
Is there a synergistic movement? Maybe you'll talk a little bit about the new biotech park, 23 acres, Pegasus. Is that something of keen interest to you as well?
Well, we're there. So we are, our accelerator is located at Pegasus Park, and this development was just opened this summer for all practical purposes. And we like the environment of being around more innovators in healthcare. There's also biolabs, which means you can have fractional lab space and office space. There's all sorts of synergistic organizations in the building that you rub elbows with and run into. And that's an important reason why we moved here. We also felt we are, in our region anyway, one of the key leaders in innovation in healthcare. And if we want to play a role in that, we should be where we can be most effective and have the most impact. So purpose-driven conversations in the elevator, in the parking lot, or having a beer across the street at Community Brewery, which is basically on campus. And as many collisions between innovators, healthcare people, entrepreneurs, students, there's also a bunch of nonprofits here, as possible to benefit each other.
Well, this has been a very interesting conversation, Hubert. I'm delighted to hear about what's going on, your center point role in all of this. What kind of encouragement for the audience would you tell these entrepreneurs to look for?
Well, looking back, our startups have raised almost a $250 million, and obviously with valuations many times that. And it's kind of, you look back and start thinking, oh, it is great, we did this thing. Well, first of all, we didn't, but they did it, and we got to be a part of it. We are very blessed too, and are fortunate. The trouble with numbers like this is, while it attracts a lot of people, it also, of course, builds that story in people's mind that all you have to do is go there and then things will happen. And this is entirely not true. So while I would say it is different from a classroom, and I've spent my time in various classrooms, it is, because we're not going to sit down and give you grades. At the same time, it is only possible to get things out of it if you actively participate and get out of it with the maximum and participate the maximum in the program. So this is something that has to be conveyed in some cases carefully, because sometimes people just see the number and the outcome and you think this is a shortcut, especially with a name like an accelerator that's supposed to accelerate everything, which I do think we do. It does not mean that it's less work. It's going to be actually more work for you because of the sheer number of connections that going to be made and the amount of opportunity in front of you. And the top of the top, take advantage of that. And we love that, of course. It's super, super high energy and very, very involved.
We've been with Dr. Hubert Zajicek, learning about innovation, entrepreneurship. The stories are many, and we're looking forward to many, many more. Thank you for joining the Business of Healthcare podcast today.
Thanks for having me. It was great.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.